The blockchain role in the security of personal data sharing in the health sector. We can use blockchain to improve security of personal data sharing in the health sector with the understanding that personal data is the property of a person. It's easy to see that this property must be in the control of its owner. And by control, we mean to grant and revoke access in a need-to-know basis. Imagine Bob going to the doctor. The doctor updates Bob's personal file and then he shares with Bob whatever piece of the record it finds necessary. Bob then go home. The data is now under the doctor's clinic control. So when Bobby goes to another doctor, a second one, because he wanted a second opinion, he decides to share the piece of information the previous doc gave to him. And she asks for new exams because she could not diagnose based on the data she has to work with. The record is incomplete. If we think about this, it's clear that if the patient has already done the same exam the second doctor asked for, it is probable the exam lab stored personal health records before and after the first exam, and probably shared just a piece of information with Bob as well. If the person decides to do the exam in a different lab this time, it is certain that there will be one more party keeping and maintaining personal health records. Now, let's imagine these three parties at least have fragmented data stored by their own means, while Bob has only partial data when it's his own medical record. Now, imagine that one of these institutions has its database leaked, exposing personal information to the internet, exposing Bob to hackers and bots that could easily get to him through this lost data. Thinking about that, we came to the conclusion that using blockchain as a database for personal health record empowers the patient to grant and revoke access, securing data sharing in health sector. With a simple explanation, we can understand what is blockchain and how we could use it to change the current scenario. Blockchain is a database, if you're not familiar with, is a data structure similar to a list of blocks where each block points to the previous one, and each block contains a number of transactions. The content of each transaction can be nearly anything, including medical records, as in the scenario of our presentation. The transactions are signed by the owner. Once the queue of pending transactions reaches a specific length, a new block is mined to store them and add it to the blockchain. Once the patients have control over their own medical records, they can grant and revoke access to the medical institutions, including doctors, hospitals, exam labs, and any other entity who might need it, and these parts will access only to append more data into the patient's record, for they will only have access to the public key provided to them, while the patient himself will have access to the history through a private key. So basically, we have a blockchain in the middle, and the doctor one in this scenario would append data to it and request access to Bob. And the same would happen to the doctor two and to the exam lab and all other third party who wants to access Bob's personal health records, or even try to store any electronic health record. They would be appending data to the blockchain instead of keeping data with their own providers. Here are some other recommendations whether you would like to proceed learning about this subject and how the research and professionals are getting there. Thank you very much.